The last year and a half since the beginning of 2020 has been anything but normal. Quickly became a crisis and people were scared. And I think leadership at that point in a crisis is critical. We had some incredible leaders that were not only leading the local area, but leading the state. I am pleased to announce the 2021 Chairman's Award for Leadership in Crisis is being awarded to Dr. Clay Marsh, to Dr. Lee Smith, and to General James Hoyer. Dr. Marsh is the Executive Dean for the Health Sciences Center at West Virginia University. Dr. Marsh, the COVID czar for the state of West Virginia, advised the governor and really worked alongside him all the way through the pandemic.
Instead of having a blueprinted, patterned response where we say, here's what we're going to do no matter what, we started to follow the data. And that, to me, makes the most sense. And we are able to follow the data and get the input of people that are the most knowledgeable about whatever that particular issue is.
Can't say enough about Clay. He is a brilliant mind, brilliant medical doctor, Clay. And I say this about Gordon too, really cared deeply about West Virginia and about West Virginians.
I've tried to stay as true as I can to what I understand, and I try to communicate things, and my whole reference point is, what would I do if this was my mom, or my dad, or my wife, or my daughter, or my sons, or somebody that I loved? How would I explain it to them? And what recommendations would I make?
There was a lot going on that he was the frontline advisor to with the state, figuring out how to roll out the vaccine. And that was really where West Virginia made it onto the national scene. If people were willing to get the vaccine and willing to roll up their sleeves, we had vaccines waiting for them. And Dr. Marsh had a lot to do with that. Dr. Smith is the director of the Mon County Health Department and really has been instrumental and at the forefront of the efforts here in the local areas.
Lee has been one of the key leaders in the public health community, not just in this area, but across the state, by the way they've responded, the work they've done, the level of professionalism.
His staff, under his direction, worked to do contact tracing for all of the cases that we had in the Morgantown area. Without their efforts, the spread would have been way worse.
We took this very seriously and felt that this was going to be a key component of, one, acknowledging the amount of disease in the community, but then trying to put the brakes on in this particular area because this is where spread occurs.
The thing that Lee represents to me is not only somebody who's done extraordinary work during the COVID-19 response, but he represents a future state for us that should enable us to be better for the next responses that we need.
General James Hoyer has led the National Guard efforts and been on the governor's response team throughout this pandemic as well. He heads up the interagency task force.
As the director of the task force, you're the catalyst for bringing synergy together for the governor to keep everybody focused and going in the right direction, to block and run interference so really smart, talented people can do their job.
The vaccine rollout was a point that we have gotten lots of credit for in West Virginia. The rollout and a lot of the operational details are really to the great oversight and skill of Jim Hoyer and Joe Peel and all the people that sit around the Joint Interagency Task Force.
It was amazing and efficient what General Hoyer really organized in conjunction with the Mon County Health Department to pull off.
Jim is a very smart man and is really the epitome of a leader and loves the state, absolutely loves the state.
It's just been unprecedented what the state has responded to. And it's been the most complex and still is the most complex event that I've ever been responsible for.
Each of us has our role, but any one of us without the others and without the people doing the great work on the ground wouldn't have nearly the same impact. And so I like to think of us really as a team.
We now had a common enemy, and for all of us to work together, I think was one of the high points of this, and shows us certainly what can be done when efforts are combined.
Really, Jim Hoyer is representing all the people that have worked on this for the last 571 days. All the people that work in that interagency task force, all the young National Guard soldiers, all the DHHR workers, the local public health folks, and more importantly, their families.
The people that show up every day to work in the healthcare industry, putting on a mask and a gown and gloves and tending to people who are sick, knowing that you're in harm's way, I think are truly the unsung heroes.
We really do receive this award on behalf of all the people that have been so critical in this crisis response, and that's a lot of people.